welcome to Holden Healthcare's blogs, and David Holden, naturopath, specialist in naturopathic oncology, nutritional biochemistry. I wanted to talk today with my colleague Marion Stobie, who I've worked with for 25 years now, as a team, particularly with cancer patients, on Fitgenes DNA testing. Marion, can you give the audience just a brief background about yourself?
So I'm a medical herbalist and naturopath. I graduated 25 years ago. I practice both with David in collaboration together with difficult clients, and I also work in a clinic by myself. I use a biofeedback system to help us prioritize treatment plans for our clients, and I also use Fitgenes DNA profiling for clients that require much closer, personalised, tailored nutrition plans that work together with their own genetic constitution and makeup.
Great. So you're a certified genomics consultant, you did training over this. So how is a Fitgenes test done?
The Fitgenes test is done by, there's a kit like this, which I give to the client when they're in their first session with me, after having taken their history and confirmation that they'd like to undergo the Fitgenes test. So having got a number that correlates to the test that they're given, they take the kit away and produce a saliva sample, which is there's a test tube in here. They put the saliva sample in that and tick the boxes in the certificate inside, and they put the whole thing in the courier bag, which is also in the kit, and they call up the courier, and the courier picks up the bag at no further cost to them. The courier takes the kit to the supplier, the agent for the Fitgenes in New Zealand, and they send it off to Australia where the laboratory is. The results tend to come back about 3 weeks after receipt of the saliva sample, and they come back to me together with the report. I read and collate the report, which is quite a long report, and I put together an action plan on a separate report and make an appointment to see the client. And when the client comes to see me for the second time, they receive a report like this, which I have bound like this for the client's use, and like this, if you can see that there's coloured coding here. So the colour coding shows that if there is a green spot, it means that everything is fine and there isn't a problem with that particular gene. If it is yellow, it says that we need to monitor this. You may be at risk for developing this particular health condition, such as cardiovascular problems and diabetes. And this red one in the far right column indicates that there is a strong genetic predisposition to developing those conditions. So it's a very, very easy to read report, but the report that I write puts together the recommendations. So we've got all this information. What do we do with it? How can I implement all these wonderful things that you found out about me, and make progress in the right direction? Right,
so we know from the work of Bruce Lipton with the epigenetics that the only two things we know scientifically that can change our genetic expression is our nutrition and our thoughts. Okay, so you obviously give them some guidance on epigenetic factors, diet, lifestyle, mindfulness, etc., etc. Great.
Yep.
So what's the cost to the patient for this test and your consult?
So the consult is $220, which is about an hour and a half for the first consult. Then the test is $499, and there's the consult afterwards, which is also $220.
Right. Okay.
There's a second test which is called Carb choice. The process is exactly the same as the other one, which is called Health and Wellbeing. Carb choice is for those people who can't lose weight, for instance, no matter how they try, or who always get sore stomach and they don't know why. Carb choice is exactly the same, but the report is about half the size, and it does tell you tells us how that person metabolizes carbohydrates and which are a better carbohydrate choice for them to make.
Right.
And that cost is $2.99.
So what would be the key things that you'd get out of this test for a patient like cardiovascular disease risk, diabetes, cancer, fat gene? Tell us a bit about what the key things are that would interest people. They can find out, yes, I've got the gene, or no, I haven't.
Well, really, that you've described that in a nutshell, David. That it does tell you, yes, I've got the gene, or this is why I can't digest, why I can't cope with coffee, for instance, and the consequences of that, whether you can have alcohol or not, or sugar, and it tells us all about those sort of things, arthritis, all the big main health conditions that we can encounter. Yeah.
So the key benefit for you as a patient getting this test done is it'll show you exactly what your genetic risk is, takes all the guesswork out, doesn't it? So we can write a proper plan, or you can write a proper plan for the person, and they can see how they go to reach their health goals. So it gives you more tools to do that, doesn't it?
That's right, yes.
Great.
I had the privilege of seeing a mother and son, adult son, and it was very interesting to see what genes he had inherited from his mother, which resulted in some of his health conditions. So that's very interesting.
So I would say to you, if you have some spare money to spend on this test, and there's a family history of any of the big four, particularly cancer, arthritis, heart disease or diabetes, then this test is a must. It'll show you what your risk is, and then you can take lifestyle factors, basically applied naturopathic medicine, to make sure you don't express those genes. And I think the thing we're going to make very clear here is the old-fashioned way of medicalization of genetic testing was that your genes are a blueprint and they're fixed and they don't change. We know that's not true. We know that you can change gene expression, particularly the P53 oncogene, by your diet, your lifestyle, how well you exercise, all these other factors, supplementation, etc., mindfulness, meditation, your inner peace of mind, which is very important. And I'll be discussing with our two mind-body therapists, Viviane Berry and Suzanne Morning, about how they work on the mental, emotional, spiritual areas as well. So what Marianne is offering is a very useful test that you can access. Can it be done by distance, Marianne?
Absolutely. So long as you could provide the saliva sample, yeah.
Great. So you can do this if you don't live in Auckland, if you're overseas, or you're in the South Island or in rural New Zealand, you want this test done. Distance isn't a barrier, particularly with right now we're in COVID lockdown 3 for the second time in Auckland. By the way, we're still open during COVID. We're allowed to do that. So thank you very much, Marion. It's very informative, and please take advantage of this test. Go on our website, www.holdenhealthcare.com, and you can click under Marion, the DNA Fitgenes test, and she can contact you and arrange to have the kit sent out.
Yeah.
Thanks very much.
Okay.